bills that we're going to be talking about today have all been double referred. That we're going to do, I think there's five today we're going to do, and then we're going to have a follow-up meeting before deadline and do the other four bills at that time. So first up, we have Senate Bill 2386, Medicaid reimbursement services beneficiaries, hospital assessment related provisions, bring forward sections related to. All this is a dummy bill or a placeholder, if you will. There's a lot of movement going on in Washington right now. Not sure what these outcomes are going to be. So we're going to bring forward this bill. And again, it's basically a placeholder to see what happens down the road. So, are there any questions? There's a motion title sufficient to pass. All in favor? Aye. Opposed? Thank you. That'll be reported. Next, we have the Medicaid Senate Bill 2388, committee sub. Basically, what this bill does is it allows the Department of Medicaid to utilize non-opioid medication. It doesn't require them to do that. The original bill had also had the state health plan picking up this particular request. In discussions with the chairman of insurance, apparently there are a number of requests for to be included in the state plan. He has turned those down pending further study. And so with that, and to advance the bill, we removed that particular section. So all this does is it relates to Medicaid. Are there any questions? Is the motion title sufficient to pass? All in favor? Aye. Opposed? Bill will be reported. Senate Bill 2392, Certified Community Behavioral Health Clinic. Senator Hickman, let's put that back. Senator Hickman was supposed to be here to present that. Can you get him? We're going to move on to Senate Bill 2397, Mental Health Facilities. What this bill does is it adds adult services to our listing for Medicaid services. Section 1 basically includes the definition of these facilities. And then later on, back in the back on page 39, we have the reimbursement for those services. And again, we don't have a cost report on this bill. It's going to go to appropriations, and we'll have one at that time. Now I'll yield for any questions. Yes, sir. Senator Horn.
Thank you, Mr. Chairman. This bill is specifically about mental health facilities for adult.
Yes, sir.
Yeah. So are you aware of whether your committee or any other committee, maybe the Public Health and Welfare Committee, is planning to address further regulations of personal care homes?
I believe there is a bill in public health to address that. It is not in our committee for this session, but I do believe I saw something in public health.
Thank you, Mr. Chairman.
Is there a motion? Title sufficient to pass. All in favor? Aye. Opposed? That bill will be reported out. Senator Hickman, thank you for joining us. I introduced your bill 2392 just a moment ago. Would you mind explaining that to the committee?
Yes, thank you, Mr. Chairman. Sorry, of course, today is a day, I call it a day of steps where we're up and down, trying to figure out where we should be. But basically, this is a bill that I'll start out by saying it is one of the rare times where we have a lot of moving parts and actors involved in this. And for the most part, we all agree. And so that's good. But basically, this starts a pilot program for certified community behavioral health clinics. and basically what it would do is it would allow for the Department of Mental Health to be able to certify community behavioral health clinics. And then that would enable them to start a pilot program to draw down federal funds that would then allow us to use federal match dollars for a lot of things that we pay for now. This is a program that would go through Medicaid, but it basically tells the Department of Mental Health and Medicaid to get together and apply to bring this program to our state. I've talked extensively with the Department of Mental Health, and what we're looking at is a pilot program of maybe 2 or 3 BHCs. The one thing that I've been interested in note, and they have some handouts, they're here with us, Wendy's here with us, and come on, say it out loud, I can't. Phaedra, right, I'm sorry, my mind. Phaedra is here with us, whom I've met with a lot, but they have some handouts that were very interesting. And I'll just say this, that there are 20 states participating, and I like to have states that we're analogous to talk about. The one that I think we're most comfortable to is like the state of Oklahoma. And every state that's implemented this program has seen a return on their investment within 3 years of the program being implemented. And there are several ways they've seen that, but all of the states around us are participating or have started to participate. I think the only state around us that is not, from my understanding, is Louisiana, and we'll be in competition with them in applying because they passed this legislation. They'll be applying as well. So all of our friends are in this program. I think it's an easy bill that everybody can support. It's had bipartisan support in the federal government, and if you can do that, it's an amazing thing. So I'll yield if there be any questions.
Are there any questions, Senator Horn?
Thank you, Mr. Chairman. I'd like to hear just a little bit more about this. I think it's a great idea. I know that we've had the psychiatric unit, I believe, at the medical center to shut down, and we've seen a lot of uptick in our unhoused population with mental health problems in Jackson. And so I think it's a great idea. And Senator Hickman and I would like to just get a little bit more information about it and to learn how the pilot sites are going to be determined and selected.
So there is already a set of regulations that come from the federal government, but also the Department of Mental Health already has a set of things they'll look at. Now, what we're looking at when they're being certified as a CCBHC is that regional health center's ability to be ready to implement the program instantly. And so basically they will open up for all 11 of our regions to submit application, and they would rank them by their readiness from most readiness to least readiness. And from my understanding, they would pick the first 1, 2, or 3 that are most ready to implement this at that moment. And our idea is we've seen it work so well in other states that we should presumably through this pilot, after this pilot, have it implemented all over the state, but that will also give the regions that are not ready time to get ready, because even if we said we're going to do it all over the state, everybody is not ready, and it takes time for them to implement things they need to be, or in order to be certified as a CCBHC, if that makes sense. Now, I'm not good on all the technicals, but again, Phaedra and Wendy are here, and you can ask them any questions you have after. They have some amazing information, some amazing handouts that they can give to everybody, and I'm sure if this makes it to the floor, we'll put this on everybody's desk because they can see it's a great program.
Thank you. And do we have an idea of how many people per pilot will be served?
I don't have those numbers, but like I said, basically it'll go through our regional facilities. And so they would take it and however many people they're servicing that fits within these non-service areas that are served, that's where we would go.
Okay. Mr. Chairman, if it's okay with the chair, can we ask Dr. Bailey if she would step up for just a second?
Absolutely.
While you're coming up, Dr. Bailey, I know that you're well aware of a lot of the mental health challenges that we have in the city of Jackson. And I'd like, if you could speak to whether this particular area of the state might be considered ready to move forward in a pilot like this?
Actually would be. It would be one of the top community mental health centers that would be ready because we've already done some initial readiness review. Also, Region 9 Hines Behavioral Health currently has a CCBHC grant.
St. Hines Behavioral Health does? Okay.
So they've been able to do some groundwork already over the last year or two. So yes, they would be one
So
considered.
a lot of the regional facilities are already aware of this program and are trying to get ready for this pilot.
Yes, they're all aware of it, and about half of them have an individual grant where they've been getting even more prepared. And then several of them have been working with the Department of Mental Health on the planning grant that we received from the federal government. So there's already been a lot of work done.
And we've been awarded a planning grant and it's being implemented right now. That's how we got to this point.
That's exactly right. That's how we got to this point.
Okay, and would Hines Behavioral Health or other regional facilities be eligible to be determined to be certified facilities? Okay.
That's right. And we already have the standards. The planning grant allowed us the opportunity to go ahead and have a committee. We worked through, we developed operational standards for certified community behavioral health clinics, and those were, went into effect November 1st. So the standards are already there. Yes, sir.
Thank you, Dr. Bailey, and thank you, Mr. Chairman.
Senator Boyd.
This has been, I've been to several national meetings. I've looked at this a number of different ways. This has been an incredible game changer in a lot of our rural states particularly. Just because of the nature of what our community mental health centers do. But this has been a true game changer for them. This functions, most of us are very familiar with our FQHCs. And so the functionality of this, don't let me misstate here, would this not be kind of like in the same way that our FQHCs function, they get enhanced reimbursement, but this would be done through the resources of our community mental health centers. Is this right?
That's correct. And also, we actually have a support letter from the FQHCs. They're very supportive of the project. Another way that they can work together is one of the very large pieces of a CCBHC is care coordination. So of course, individuals who have a serious mental illness also have health conditions, diabetes, high blood pressure, many chronic diseases as well. So a certified community behavioral health clinic has to have an agreement or either offer primary care as well for integrated care. So if you have an individual that's coming to the community mental health center for serious mental illness, they also will be connected to their primary care as well. And that's a very large piece of that. And so is same day access, so timely access to.
Thank y'all. I'm excited, especially after the hearings that we had this summer on youth mental health issues. Oftentimes they're not that different sometimes from our adult population, and there's a vast need across the state. And if we could start to fill those needs with this and offer the funding that this would provide, that would be incredible. So thank y'all.
Mr. Chairman, one final question.
Yes, sir. Go ahead.
So Dr. Bailey, can you guesstimate how many individuals might be served per facility under this pilot?
There were probably about 80,000, between 80 and 90,000 individuals who were served by the community mental health centers last year. Now, it would be, of course, the individuals who have Medicaid because it's a Medicaid program as well. So you would have those individuals that would be served. The exact number would be dependent upon which regions were selected as the pilot, as how many people are being served in that region. But that's right. Every person who walks through the door, one of the requirements, that's a great point, Phaedra, one of the requirements of a CCBHC, and this is a national requirement, so it's a standard, is you serve regardless of the ability to pay.
Thank you.
Any other questions? I'll entertain a motion. Is motion title sufficient to pass? All in favor?
Aye.
Aye. Opposed? Okay, that bill will be reported out.
Thank you, Mr. Chairman, and thank you for allowing us to present this as a team. I really needed the backup. I appreciate it.
You did fine. Last, we have Senate Bill 2748, Mississippi Medical Cannabis Act. Kind of surprised this came to us first. It's double referred. It goes to appropriations later, but this bill does not expand any of the conditions. This bill does three things. One, when we first initiated the program, we used Missouri's formula for equivalency units for kind of how to measure THC. Unfortunately, there's flaws in that. And the way it's currently designed is that we're incentivizing people to smoke, to move toward smoking flower instead of ingesting gummies or concentrates. So what this basically does says a gram of THC is a gram of THC is a gram of THC. So that addresses that on page 9. On page 15, it's going to allow telemedicine evaluation for patients who are homebound or bedbound, and it needs to be certified by a practitioner who is not the practitioner making the certification for medical cannabis. And then last thing it does is any applicant for a medical cannabis establishment has to have a license first from the state before they go to the county or municipality to apply for a business license there. That's an explanation of the bill. I'll yield for questions. So hearing none, title sufficient, do pass as the motion. All in favor? Aye. Opposed? Okay, that bill will be reported out. Thank you guys for showing up. We'll have a second meeting early next week, most likely Tuesday before deadline. Thank you. Advisory report.